All right, so welcome everybody. We're earlier than normal because Jeff's headed out of town, and so it's earlier than our normal ozone training or MedMasters or whatever company you know me from our regular scheduled programming. But glad to have you, and if you're missing out on some of your day to be here, we appreciate that. Um, as some of you may know, maybe this is new to a lot of you, Florida did instate some legalization of stem cell products. And I guess because they're legal, you can even say stem cells versus human cellular tissue products and what have you. So, when I asked Jeff, I was like, do you know about this? He's like, Kim, do I know about this? So I thought I'd open that up to our audience to learn more about that. And if you're not in the state of Florida, I'm sure that Jeff has some good insights for us there too. So, Jeff, do you want to take 2 minutes and just, if anybody doesn't know you, I mean, talk about Ava a little bit. I encourage everybody to join Ava, but tell us a little bit about you real quick.
Yeah, I'm a healthcare business and regulatory lawyer and been doing that for 39 years. This is my 39th year, which is really weird, but it is. And so I just represent healthcare businesses and healthcare professionals, usually creating businesses and dealing with the bad stuff. FDA, FTC, state and federal regulatory stuff, lawsuits, and we do that all over the country. In this space, little known fact, people don't know it. When I was a kid, there was this fake hair company called the Hair Club for Men.
Oh,
And
yeah.
yeah, and so there was this dude who started the company, and he said, I'm not only, I not only use it, I not only bought the company, I'm a client." The short story is, I've been a patient of stem cells, exosomes, PRP for about, I don't know, 20 years, something like that. And I've been representing people in that space when there was no such thing as regenerative medicine. It was just stem cells. Nobody called it regenerative medicine. Regenerative medicine was the fancy word to come up with so you wouldn't get in trouble with the federal regulators using the word stem cells on your website. So, anyway, so I'm a big fan of it, and I've been fascinated by it. And like many of you on this call, I've got miracle story after miracle story about how it's helped me, and I couldn't help but represent it and start representing it. God, 20 years ago or more, 25 years ago.
And
So,
honestly, that's what I love is, everybody needs a good attorney for multiple reasons, unfortunately. But, if I say EBU to you, you know what that means. If I say peptides to you, you know what that means. I could specifically talk peptides and you know what that means.
mhm.
There's just I don't know if there's anything. Plus, you have these organizations that work so much with nurses and nurse practitioners who might need medical directors in their space and the legal side of that. Franchises, I want to talk to you about that a little bit. If there's any franchises listening, I know I talked to one this morning who was hoping to jump on. So I just
Mhm.
feel like not only are you a consumer of it, but you really are inundated in it, and so there's just so much, and you're just such a kind man. So. And
Thank you.
Ava, talk about Ava for 2 seconds. Ava is this organization.
American IV Association. Um, God, I don't know how many years ago it was, 5 years ago maybe. We started getting a bunch of phone calls from nurses saying, "I've had it, I'm fed up, I got to get out of the COVID environment that I'm in." Very stressful hospitals and skilled nursing and stuff like that. And they flowed into um, the beginning of the IV hydration space, which was, I've got IV products and a car, and that was it. There was no brick and mortar back then. And, so we saw the beginnings of a wave of what became an industry, and we had no idea that was going to happen. But the calls went from one a week like that to five a week to 10 a week. And then we had people who were not just inspired clinicians who wanted to make a difference in terms of immunity and inflammation and hydration and stuff like that. They wanted to become entrepreneurs and business people, and they attracted serious, accomplished business people into the space. So when we saw that there wasn't a single source of information and resources for the IV hydration community. We just created it. It's called the American IV Association, AVA. And I guess we created that about 3.5 years ago, something like that. And and if you want to get in business, you can go there and figure it out. If you want to stay in business, you can go there and there's all kinds of resources. If you want better prices on things, if you want stuff that's uniquely valuable, for example, regulatory defense coverage, not just med mal defense, you can get it there. And so that's what we look to do, is to aggregate that community, have them define quality instead of it getting defined at them by regulators who don't really have the precision or the detailed information to do it effectively. So we do a lot there, and we're about to do that. By the way, sneak peek, if you don't mind the comment, we're going to do that in the peptide space. So American Peptide Association is going to launch whenever my team tells me it's ready, within the next couple months. So we'll do that there too.
Awesome, awesome. That's good to know.
Mhm.
Yeah, you said it better than me, but you don't have to be a mobile or just an IV hydration facility or clinic or provider to get value out of Ava. I would recommend everybody go and check it out. And there is a membership, but man, you'll totally get your money's worth out of there. So,
Thank
uh,
you.
all right, let's start in on this.
Yeah.
I told you I was going to start with just the big question.
Yeah.
Give us an overview of the current regulatory landscape for stem cell. I guess we call it legalization in Florida.
Yeah. Well, it's a funny thing, Kim, because you know it's discussed as being something of a transformative law, and in some ways it is, but not the way usually people think of it. Um, it's transformative because it expresses a mindset by the state of Florida. And the mindset is, we don't care what limitations or concerns the FDA has. We got this, and we're going to propagate the use of stem cells. And that's a very bold position for a state to take. Now, in fairness, I'm not sure how bold it is, but it's bold. I say that
Not
because,
like you just said, let's give him an opening.
well, I'll tell you why I say that. Because years ago, God, 20 years ago, when stem cells was tip of the tongue and the FDA was going after it, and the Federal Trade Commission was shutting down sites that made promises about what stem cells are or what they do. When that happened, it was um, it was the Wild West, and it was incredibly difficult to do business in that space. Since then, so much of the regulatory intent, which was, hey, don't overpromise, don't say it's going to fix COVID, don't say it's going to fix Parkinson's, don't say any of that. Everybody towed the line and everybody dialed it in, but nobody stopped doing it if they were committed to doing it. So what happened is people stopped talking about it the way they were talking about it, but their clinical behavior with it remained the same. I'm not aware of anybody who was committed to it then that said, "Oh my God, the FDA or the FTC is shutting down websites that are making promises," who said, "I'm no longer into this. I'm not a believer anymore." What I saw is people were doing it on the down low. That's really what happened. So what the law does is it makes people feel better about doing it, because even though the law, it has a narrow application, the only greenlit application is of certain products that meet the qualifications in the law, which isn't everything that's out there, number one. And number two, applied by MDs or DOs. And number three, only for uh, pain, chronic pain, orthopedic issues, or wound care. That's it. So the cool thing about the law is, in my view, it expresses a mindset that's really taking hold in this country, not just in Florida, which is, I'm a human being. I want to look better, feel better, and I want the freedom to make the choice about what I use. Now we see that in the IV hydration space, in the stem cell space, in the peptide space, in the med spa space. We see it everywhere. That movement, I never thought I would see the kind of traction that it's getting, including at the regulatory space. Um, but it's here and it's now and it's not going away. It's going to grow, it's going to expand. And even though the Florida law is kind of a narrow slice of the pie in terms of what's okay, um, it's going to grow and it's going to expand. So, and two final pieces on that. Um, RFK Jr. is a controversial guy because he says things that some people don't agree with, and some doctors don't agree with, some scientists don't agree with. But his passion for democratizing wellness, if you will, is evident. Now, the guy who really gets my attention more than even RFK Jr. is Marty Makary. He's the head of the FDA, and he wrote a book called Blind Spots. If you haven't read it, read it, because I'm 65 years old. I've been practicing law for like 40 years. I've been a wellness curious guy and an aficionado of it for a long, long time. And I never thought there'd be anybody in the government that would be able to be as outspoken, honest, and transparent as he is about not about wanting to be guided by real science and not be limited by what he calls medical dogma. I didn't know anybody in government was allowed to use the phrase medical dogma, but he uses it in his book, Blind Spots, and he's an incredibly ethical guy who's driven by the scientific method, and he's a remarkably um, inspiring guy. And for him to be in the position that he's in, I never thought I'd see anybody like that in that position. So it's an incredible time. The use of stem cells, the laws at the state level that greenlight the use of stem cells for specific reasons by specific people, that's going to flourish. You're going to see that happen in a big way within the next few years. Once one state does it, the other states um, feel more comfortable and feel emboldened, and we've seen that in every emerging space. So it's an amazing time to be somebody who believes in feeling better and not fading out quietly in life. It's a great time to be around.
Yeah, it's very exciting to see. I wasn't gonna name drop some of those people, but you did.
Yep.
And that was the rumor I had heard where those guys were kind of behind this. They were some of the prompting behind getting this into legislature, and
Yeah.
I wasn't sure how true that was, but it seemed fitting.
You know what, they are, and they're very, very bold, very brave people, because unfortunately, healthcare. I'm preaching to the choir here, and I'm not saying anything you don't know, but healthcare has become corrupt. It's just been corrupt, meaning scientific impeccability gets compromised in the name of financial control or profits or greed. And, you know, it's difficult to disentangle that. But I think there's a huge cry for it among the public, and an increasingly large cry in the physician community, which is amazing to me. Um, Early in my career, I worked for the Florida Medical Association, which was the Florida's association of physicians that advocated on behalf of physicians around the state and in the legislature. And I can tell you that back then, you know, there, if you wanted to color outside the lines as a physician, like you wanted to do, for example, chelation therapy, you were taking your life in your hands, you know, back then. I worked for them when I was 29 years old, I think it was. Anyway, um, so you really had to watch what you said, and you really had to watch how you expressed yourself, and you knew the rules, and you could only say certain things and do certain things. Um, those rules have changed. Those you know, the roads that are available for people that believe in ozone therapy or EBU or or methylene blue or anything that was dismissed 30, 40 years ago as quackery, all of a sudden, physicians with impeccable degrees, Chris Seitz, um, you know, drawing a blank on some of the other guys. The medical director for Liquivita is, God, I'm drawing a blank, Chris. Amazing men. And Natalie, I talked to Natalie Teague the other day. What a remarkable leader and what a brave person to say, listen, I have a brain and I've got medical training and clinical training. I'm taking responsibility for studying and deciding whether I'm going to offer this. Um, and they do it, and they're very outspoken for people like us on this call who want to learn. I really am doing it at a time when it was difficult to do it. Early in my career, I got a phone call from a guy in Florida who had a board of medicine issue. He was called before the board of medicine to be chelation. So I represented him, took care of the thing. And then last year there was somebody who, in another state, board of medicine for Ebu, ozone. They said it was quackery. The board of medicine in Illinois said it was quackery, and I had to deal with that with him. So those days aren't done, but the times have gotten a lot easier for physicians to be true to themselves and really lead in a way that was probably career destroying years ago.
Yeah, I love that. That's such a great way to put it. It feels like much like with you and as an attorney, we got blessed enough to have somebody or a couple of people at least in government that also have a personal desire to see some of this medicine and utilize some of this medicine, and so use their authority or power, whatever you want to call it, to see some of that propel. So I think we're super fortunate with that. Agree with it or not, agree with the person themselves or not, they are proponents of this type of medicine, which is going to help move it forward. Because when you talk about initially that, people who are using stem cells were going to do it regardless, that alone isn't enough to prompt legislative change or governmental, we got to have somebody in the government along with somebody, providers, etc., that have studied it and utilize it and have clinical experience with it to come together to move that forward.
Yeah, and we have some real challenges ahead too, because like every healthcare item and service, the challenges are always the same: quality and greed. So we have those issues here. We have products out there that really shouldn't be out there, and we have people using them in ways that are not driven by clinical excellence. They're driven by greed.
Yeah.
I think the one way that people are most probably informed about that has to do with the amniotic tissue in the wound space, um, which has become the favorite target at the federal level of prosecution. So we deal with a lot of that, and and also payer clawbacks, audits, and clawbacks, because people are not clinically leading. Something else is leading, and usually it's either greed or abdication of clinical responsibility. I tell clinicians, listen, you went in to be a whatever, a NP or a physician or what have you, because most people, because they really wanted to make a difference. If you keep that, then you run the route, and the route is examine, um, diagnose, prescribe, treat, and document. That's the route that you run. Um, what happens in the wellness space broadly is physicians and clinicians, licensed people, abdicate their responsibility. They just do. They'll
Mm.
say, well, it's just peptides, or it's just, you know, amniotic tissue, or it's just whatever. And what they're not doing is driving the bus. And they really have to create the kind of sustainability that they need in any of these spaces, stem cells, for example. They have to make sure that they're the ones examining, diagnosing, prescribing, treating, and documenting everything, just like you always have. And when you do that, um, the greed part sorts itself out, and to a lesser extent, the quality part sorts itself out. But I think the quality and greed issues are going to be things that get regulated in this space and that need to be regulated in this space.
So speaking to that, like the types of stem cell products, I believe this is public document or I've seen it, a formal document to say these are the list of companies and stem cell products, which is
yeah,
interesting because I know some of them have studies and compliance in certain areas, and it doesn't always align with the fact that they say pain, orthopedics, and wound care. So talk a little bit about those products that are legalized, and how that correlates with the application of them.
yeah. Well, I mean, the type of products are right in the statute, and I'm happy to send it to you. The problem is that it's the products that aren't mentioned. Like
Hmm.
they don't specifically mention exosomes, for example.
Oh.
Um, you know, there's a lot missing from the law, but it's a great first start. And in fact, I'm sure it was intended as what can we pass? Let's get a foot in the door. We'll come back next year and we'll get more precise with it. Um, so yeah, so there's an issue in terms of the product clarity that needs to get worked out. Um, and but I've been assured that that's going to happen. Uh, Now let's talk about what's happening in parallel with the law because I think that's just as important. I mentioned that the Florida law says that MDs and DOs can administer this, and it says nothing about NPs, PAs, or RNs. It doesn't say anything about that. So there's some lack of certainty there and room for some interpretation and a level of risk taking depending on your your decision there. Do you interpret that your staff could do it while you're there because you have mid-level practitioners that are on site? Do you interpret it that they can't administer because the law doesn't say they can? Um, those are questions, and those are kind of nuanced questions that we pull clinical platforms and clinicians through. But let's look at what's happening side by side with the law. We know MDs and DOs are mentioned. Does that mean podiatrists aren't using stem cells? Nope, doesn't. Does that mean dentists aren't using it? Nope, doesn't. So, how about the three conditions that are specified in the law? Chronic pain, wound care, orthopedic. Does that mean people aren't using stem cells for other stuff? No, no. So the law is a green light. If you want to travel and stay in strict compliance with that law, then you can go 70 miles an hour and you're not going to get pulled over. Great, just comply with the law. Does that mean that if you bend compliance in a way that you're going to get pulled over and you're going to go to jail? It doesn't necessarily mean that. Of course, it depends on how far you go in terms of the clinical protocol that I just mentioned. But I can tell you there's a vast um, enterprise out there for exosomes and stem cells and PRP that are applied for many things: P shots, O shots, facials, hair growth. Keep naming it. There's so many things, and I know systemic applications that are being done out there for epilepsy and Parkinson's and all kinds of things, neurodegenerative disorders. And they're smart enough to know, having been through the early days of stem cell regulation, you're probably better off not talking about it on your website. So that's really what's happening. In other words, clinicians are doing what they've been trained to do, which is use your medical judgment. Use your medical judgment. And then if you talk to a guy like me, you're going to mitigate your risk. How do you do that? Have the right informed consents. Have your websites looked at and scrubbed so you don't become a target. Don't be stupid, you know? So if you do just those two things, there are other things that you could do. You can import third-party studies. You can have that on hand. If you're going to use a product, make sure that whoever you buy it from puts in writing why their stuff is the safest and best. Because if anything goes south and a patient says, my arm doesn't work after you injected my shoulder, for example. Um, and you get a lawsuit or you get a regulatory investigator, they're going to say, because they always say the same thing, the only reason why you used the product and shot that shoulder is because it's not because you diagnosed, prescribed, treated, or documented. You didn't do that. You didn't examine. You didn't do any of that. You were just trying to make money. So, what do you need to do to counteract that? Because it's always the same allegation. Well, you have to document that you examine, prescribe, diagnose, treat, and document. You got to do all that. And then, in terms of the products that you get, make sure that you have in writing from the manufacturer a ton of data and information by them that shows you not that it's the best price product, but it's the top quality product, and save that. What else can you do? Well, import studies and save them. Even better, go get some certification. Don't just be somebody who knows a lot. If you can afford it, the time, go get some certification so that you differentiate yourself from the pack. So that if you do have a problem with any state or federal regulator or a plaintiff's lawyer, you can say, "Look, I'm not just I'm not doing this to get rich. I'm doing this because my job is to help heal people, and I'm doing it right."
You just answered 10 questions in your little paragraph. You must have known they were coming.
Something
Um,
like the other thing I can say, Kim, is this: there's something called regulatory defense insurance coverage. Um, Everybody on this call knows about med mal, meaning that you might get insurance that covers you if a patient sues you for a bad outcome. But there's also a different kind of coverage called regulatory defense coverage that kicks in when the Board of Nursing or the Board of Medicine or the FDA or the FTC comes after you, because the biggest expense that you're going to have there is probably guys like me. Yeah, it's the legal expense. That regulatory defense coverage is not what you might fear that it is in terms of cost. It's affordable. It's worth considering. It's another layer of coverage and defense that you probably ought to have in your arsenal. Um, I can provide to Kim a couple sources that I routinely refer to because I asked them to develop that policy for Ava.
oh,
Yeah,
fantastic.
yeah.
Fantastic. That's even in ozone, that's the one of the biggest questions is what do I do for malpractice or coverage, et cetera, et cetera. And I'm sure it's a big one here. Like, how do I explain this to my malpractice? Who's going to cover it? And what is that? Maybe those, those inserts, I guess, that might be subjective to the service that you're providing. So that I'm sure will be very helpful if you have that. Um, one of the questions that I was meaning to ask was, I don't remember now. I was reading this comment here in terms of other states, and I think what you're saying, well, let me go back one step. And this happens in ozone and our world, and it's happened to some, personal companies that I've been working with, but where do you see or how does it play in that even you said this, right? Practitioners get to choose the way that they practice medicine to a certain degree. But at what point and where can the FDA step in and change that up on somebody? Because,
Hmm.
it's like, hey, well, yeah, I get to choose chelation if I can, diagnose, exam, prescribe, treat, and document. But at what point can the FDA come in and say, I think differently?
I see you freezing too.
Yeah, dude, I'm like, who is it, me or you? I think what you said was they
Me or
regulate the
yeah,
product.
yeah, yeah. Um, yeah. So FDA can't come in and take action against your license. They can't do that. Um, what they can do is impact the availability and the type of product that is made available. Like if they took off, against, for example, PRP, and they said, "Oh, PRP is killing people," and they made it federally illegal with consequences. Well, that's going to constrict that product. That's within their authority. It's not within their authority to say, hey, Dr. Smith in Texas, we're coming after you for practicing medicine in the way that you're doing. What they might do is report Dr. Smith to the state medical board. That could happen.
So in terms of stem cell products, does that mean you have a little bit more protection if you're working with a lab or a manufacturer that has some type of compliance documentation with FDA? Because they do exist.
Yes, absolutely better off with it. Yeah.
And I would say if you're asking for documentation on third-party studies, document why you say your product's better and best and whatever, you also want documentation that says your status with the FDA.
100%.
Okay.
Yeah.
Okay.
Yeah.
Makes
These are, I mean, these are ways that you can kind of, how you can shore up your own compliance and become less of a target. The truth is, the nature of the physician-patient relationship, or clinician-patient relationship, is that it's kind of sacrosanct, and the federal regulators are not excited to jump in there and disrupt that relationship. So there's a bit of a inclination to respect it to begin with and not to intrude. So anytime I see, you know, um, a physician or a clinician taken to task for their clinical decision making, it's usually coupled with something else, like a patient got injured and complained, and the clinician or physician wasn't able to resolve that dispute, or a competitor. One of my favorite stories in the space is there was there's a Society for Responsible Compounding, or Concerned Citizens for Compounding, something like that. And this organization um, dropped complaints all over the country with boards of pharmacy everywhere against this company. And and so we got called to defend these companies around the state, this country, that received those kinds of investigations by the boards of pharmacy. Well, we investigated, we found out that Society for Concerned Citizens, or whatever it was called, was started by a competitor who decided, you know what, I'm going to put all my competition out of business by starting a phony organization, and then under the letterhead of that phony organization, throwing all my competition under the bus. So that's where, the most unlikely sources of a bad day or restriction or constraint, it comes from that. Um, in the For example, we're very involved in the peptide space lately for the past year and a half. Anyway, so you get these FDA very formal looking letters on FDA letterhead, and also very formal letters from Eli Lilly and Novo Nordisk, who are GLP-1 stakeholders, on their letterhead. And it's, people, and we find out they're phony. They're made up. Oh, yeah, completely phony. So when we talk about real threats to the industry, I don't think they're as much regulators as they are upset former employees, upset patients, and competitors. Those are probably the three. The mood is really shifting on stem cell exosome PRP use in this country. The days of the FDA and the FTC, coming in with a ladder truck to climb up your building and put out the stem cell use, I don't think that's what we're going to see. I don't think that's what's on the horizon, unless there's some shitty product out there that hurts people, and then I think we'll see it.
And as we should
Yeah,
in that case, right? We're
yeah,
gonna self-correct by calling
right.
out that problem.
Yeah, we also remember the the days of COVID, that anybody who said anything might help or cure or fix or rectify COVID on their website, you immediately got an FDA cease and desist letter. Immediately.
Yeah.
So that's a sure way. So if you really want to get into troubles here, with your clinical decision making, your informed clinical decision making. Piss off a patient.
You're back. I think maybe there you are. Maybe. Yeah, I think you said piss off a patient, former staff, or a competitor.
Off and on. I guess we're in and out.
You having some storms over there?
Yeah, yeah.
Oh,
Matter
great.
of fact, yeah.
Great.
Matter of fact, sunny Florida is not so sunny past
Okay.
couple days. But
Um,
yeah, yeah. So that's going to be your likely source of disruption. A former employee, a patient, a competitor, or a stupid worded website that is full of passion but didn't get looked at by somebody who's got something more than just passion to add.
do you guys do that? Do you scrub down
Oh
websites
yeah,
for
yeah,
that?
all the time, all the time.
Okay. So
Yeah.
they don't have to hire you to be their entire
No, no,
employee
no.
council.
We'll scrub them and we'll knock out the red flag issues.
And I'm thinking the same thing in terms of consent forms and patient education
100%.
stuff is just because I'm sure there's certain language, certain things to have, not have, what have you, that'll actually protect you versus the fact that
Yeah,
a patient just signed.
100%. And I think clinicians are kind of inclined to think informed consent one size fits all. But if you've ever overdosed yourself with NAD, you probably, or a patient overdosed themselves, you probably wish you had some shit. You're going to feel like you're having a heart attack. That should probably be in there, you know? So every now and then, or EBU, even EBU, some people get EBU and they are wiped out for days on the back end. I
Well,
mean,
there's side effects to it or some
yeah, yeah.
disadvantages.
So just be thorough in that regard.
Okay, I get asked that question all the time. Should we have a consent for every little IV that we do, or can you
It
put me
depends.
to one? And
It depends. Depends. You know,
okay, okay,
certain things are inclined. Certain things cause alarming, concerning symptoms, and a lot of things don't.
yeah.
So yeah. So have multiples.
Okay. Are you seeing what are the next states? Is there any other states at this point that are working on this? Are there any that are less
Well, I
open
will.
to it?
The short answer is I don't know,
Mm,
but I will tell you that the states that are generally friendly to innovation, they usually are Florida, Texas, Utah, Arizona.
yay.
That's it.
Just
And
went
then or and then
Utah and got my hip injected twice.
there you go. And Oregon has been amazingly stiff arming the FDA. I was surprised.
Huh,
And,
huh.
and so, what states have been, they love regulation and they love to interfere with the relationship between a clinician and a patient. I'm overstating it, so forgive me. But those states are Rhode Island, Connecticut, Alabama, South Carolina, Louisiana, Nevada.
Hmm.
Nevada's lost their mind. They were never like that. So, but yeah,
Is
we
that
see
why
that.
most of those states have barely started to come online in terms of ozone and even IV therapy, like Arkansas, Louisiana. I mean, those states we didn't get hardly any clients from there, and now we're seeing a lot of growth, but maybe that's why. Like they just I've heard
Yes.
some describe it like it's the good, the AMA or so is like the good old boys club, and it's just they're old fashioned and hard to, but maybe it's more coming as the overseer of FDA.
Yeah. Yeah. Connecticut, the Connecticut Attorney General sued a bunch of compound peptide companies that were selling compounded GLPs into Connecticut and sued a bunch of companies. You
Oh,
know,
gee.
yeah.
Um, are there any specific, I don't know if you'd want to say this, but are there any specific companies out there selling these products that you would say stay away from at this point?
Well, I mean, I will say this rather than mention their names. If you go on the FDA website
Yeah.
and look for the warning letters, you'll see the stem cell companies that have been admonished, and then you can make a more informed decision.
And do you think that would help you even if you're not in the state of Florida?
100%.
Okay. Okay.
100%.
So it's
Because
not legal in any
because
other states.
no, because the risks that we're talking about, clinician leadership, yeah, following the clinical protocol that all clinicians are supposed to follow. Those are risk mitigating moves everywhere. Regulatory defense coverage, those are risk mitigating moves. The truth is, the vast majority of states are silent on this stem cell issue.
Yeah. Yeah. For now. Right.
For now. Yep.
Is there,
By the way, I should mention this. If you're an activist and you're especially invested in the area of stem cells or regenerative medicine, your ability to continue to do that and to grow your ability to do that will not only be tied to doing things safely in the way that we're talking about, but will be tied to what you do after treatment. Here's what I mean. Safety is the number one job and concern of regulators in this space, which is why the Florida law got very specific about the allowed product. Efficacy is what allows you to grow it and grow the use and expand it over time. And efficacy is going to be fueled by what? Data collection, outcome data. So it's great to make sure that you're safe on the front end, but if you're in it for the long haul and you want to really invest, then you're going to also invest in sustainability. That's all about efficacy, data collection. What's the before and after? What's the intervening procedure? What's the outcome? 2 weeks, 4 weeks, 8 weeks, whatever it is. The win in this space consists of it's like a 2-layer cake. Ensuring that safety is right, that's something that has to be done today. That's not something that you can work on. It's something that really has to get dialed in today, because the consequences of not getting that right are immediate. Efficacy is not something that you have to do today, but it's the other layer of the 2-layer cake that is that creates the dessert that ensures continuity and expansion of the use of this therapy.
fantastic. Here's a good question. I think both in terms of Florida and everything else, what are the differences, if any, in regulations for the autologous or patient-derived versus the allogenic donor-derived?
Oh,
I don't hear a ton anymore about patient-derived, although they exist, but I think what's currently in Florida that we're talking about in terms of legalization is all donor-derived.
yeah. The only legal language that I've seen is donor derived. Uh, Autologous is, falls under an area that the FDA doesn't like to shake up, which is the minimally manipulated, um, you know, using your own stuff provision. So I don't think that's going to get shaken. The problem with most of us is there isn't enough active ingredient in it to create the outcome that we're looking for.
Now you just got on the medical scientific side. I love the products because you can derive so much more than what old people like us could probably pull from our own bodies. So that makes sense. Um, is there is there any differences for some of the small clinics versus the larger? Is it still come down to consents and how you structure between your MDs and your MPs
Yep.
and your informed consents?
Yeah. Same stuff.
Same stuff.
Same stuff. Small, large, doesn't matter. I think from a regulatory perspective, should state or federal regulators get excited about asserting themselves, they prefer to go after larger targets because it has a chilling effect. So their job gets amplified by picking a larger target, you know.
But again, I think if you have somebody, a patient, a staff, a competitor complain about you, it's going to make waves or get you noticed, even if you're small, right?
100%. The only time I've seen a small person really get undue attention was when the small person decided that what they were going to do with the cease and desist letter that they got is change the minds of the federal regulators. It didn't go
Well,
well.
there's going to be my question is how, if you are a provider in the space and you're really passionate about this and you mentioned collecting data, as to efficacy, what else can providers do to keep it safe, effective, and pursue it legally?
Just what we're talking about. What we're talking about. I mean, all the elements of it are, on this podcast. I think one of the things that I haven't really talked about because it didn't make sense, but um, when you get contacted by a regulator, contact a lawyer that's used to dealing with those regulators. They behave very differently. They behave in a very respectful and negotiable way. And sometimes when you don't have the lawyer there with you, they take liberty. So,
You need a bulldog in your corner? Is that what you're saying?
you know what? You don't. I think that's one of the reasons why I didn't say any lawyer, because a lot of people go, "Oh, I know a lawyer. He's a personal injury lawyer." I'm like, "Don't get a personal injury lawyer. Never get a plaintiff's personal injury lawyer. Don't do it, because they're used to asserting themselves in a way that creates an outcome which is great for their profession, but it will kill them in dealing with a regulator, because
It should
regulators
make
get
sense to us, right?
what's that?
It should make sense to us. Don't go, to a podiatrist to deliver your baby. It,
Right, right,
it should make
right,
sense.
right. You know what? Honestly, I think it's a hard decision to make when it comes time, because I'm not $50 an hour, and regulatory lawyers are not $50 an hour, and it's hard. And we've got clients in this space that are doing, regenerative medicine really a lot of them out of the goodness of their heart. They're dealing with some horrible medical degenerative conditions, and they're doing what they can, and they're not making money on it.
Yeah.
So I get why they might be, I don't know how much I want to spend.
Yeah, I love that perspective though too, where you talked about earlier, where as informed consenting adults, knowing the risks and the potential for no outcome, we still may want to choose to do these types of therapies because we're in a situation where nothing else is working or helping, or it's just the way that we think and what resonates with us. And so finding practitioners who are willing, able, and do it well, um, I think that's fair. I think that that's fair in medicine to connect those two groups together. Uh,
Yep.
but it's not easy. It's not simple from either end.
No, I will say this though, after I plug my iPad in, because I'm concerned about the battery running low, and I don't know where the freaking plug is. Anyway, I'll have to figure it out at some point. Um, I will say this: I have never seen or heard of a. I think this is it. Nope. Anyway, I've never seen or heard of any clinician having a problem with their state licensing authority for doing using stem cells, PRP, or exosomes in a way that aligns with the clinical protocol that we've talked about. If they do, if they examine, diagnose, prescribe, treat, and document, I haven't seen anybody losing their license. So
Awesome. Good to know.
yeah,
I want to
and
give
and just to dispel one thing, because everybody has this question, I have seen zero criminal charges filed in this space.
that should help us. That should help
Yeah,
us better.
yeah.
We've just got a few minutes left because I want to honor everybody's time here, including yours. And there are some questions or comments here, and I want to do justice to acupuncturists, whoever wrote this. But I mean, how do you feel about, is there any progress towards acupuncturists being able, I mean, pain, orthopedics, being able to utilize some of these products, or have you seen anybody in the space with that licensing using these products?
I haven't.
Interesting.
I haven't.
Okay.
Yeah.
Um,
But I mean, what have I seen firsthand? MD, DO, dentist, podiatrist, NP, um, yeah,
yeah.
vets
Um,
and veterinarians.
I
Uh,
want, this is a good question, and they mentioned the name Vidi Labs, and I do know them pretty well. And so the question is, if the company such as Vidi Labs has responded to the FDA and had warnings dropped, is the risk lower for clinicians?
I
I
think, I think that if the FDA warning letter concerns are resolved and you see it through and it's resolved, um, then I think using that product has no more risk than using one that doesn't have a warning letter experience. And in fact, some people, especially people that value PR, will message their encounter with the FDA as saying, "Hey, we've been scrubbed and we're above board."
yeah. Yeah, and that's ultimately, I don't think that a visit from or a letter from the FDA in and of itself is bad. Because
No.
once you even comply or are approved, you still are having to submit changes or regulations or
Oh yeah.
CAD designs or whatever. You still have to continue to have a relationship with FDA. And if they come in
Correct.
with questions and then you can say all of our ducks are in a row, then it's all good. It's all
Yeah.
great.
I feel the same way with, like in the compound pharmacy space. When the FDA comes in and they issue a 483, which is their list of deficiencies and specifics, it can be pretty alarming to see. But the good side of it, when you have a responsible pharmacy, is that they're remarkably responsive and respectful, and they're cleaner than maybe others that didn't get it inspected. Because you have to remember, there's only a limited number of inspectors of the FDA, the Board of Pharmacy, or Board of Medicine, and just because they caught one doesn't mean they caught them all, because they don't. It's
Yeah, I've experienced that.
impossible.
I've
It's
experienced
impossible.
that. Those that can comply are often the higher echelons.
Yep, that's
Um,
right.
and I just had Lauren from Infusive. You know Lauren, right? From
Yep.
Infusive, Dr. Will Hawes and their group. She was in my office shadowing and we were working on some stuff. And they're an organization that where that's exactly what they're looking at is how those pharmacies comply and what standardization they hold for themselves, whether or not they've been visited. And so between her and some other pharmacists have been really it is frightening for them when somebody comes in with that type of letter or whatever, but when they can come out of it with approval, they are, I think, better than others that may not have gotten the request.
Yeah. Yeah, I mean, we've seen all kinds of responses. We have people that really shouldn't be in business and they get caught, and their response just amplifies that. And then we see people who have a problem, and the way they respond is just impeccable, impeccable. So yeah, being tech
Um,
isn't dispositive.
Yeah, yeah. Yeah, just having probably more experience than I want to with that. I do realize its place and that if you can comply, it makes things. I mean, again, once you get approval or once you get compliance, you just have to continue to comply and continue to show what you're doing and how it's working. And so
Yeah.
it doesn't go anywhere once you get that ball going rolling. I had this question too, but it's not regarding stem cells. And Sarah put it on here of this is a great question for you. Thoughts on some of the new regulations on the IV industry, i.e. Jennifer's Law in Texas. And I'm sure you've been answering that quite a bit.
Yeah.
It's still pulled up on my browser. I was reading the exact document the other day. But thoughts?
Yeah, I think it's a good start. I don't think it's over, but I think it's a good start. When they said, um, look, here are the people who can order it, MD, DO, you know, somebody with prescribing authority. Um, that made sense. When they said, here are the people that can administer it, and they left off the fact that they left off the fact that so many of these platforms are using EMTs and paramedics. It was that needs to get fixed. We're not asking. Look, my wife's a retired firefighter and an ER nurse, and she doesn't want the authority to prescribe the right IV bag in the IV hydration setting. She knows the limits of her license. I think I think from a horseshoes perspective, Texas got close. They got close, and I respect that. And I was on the call with the legislative committees when that law was being considered as part of AVA, American IV Association. But and we made the points that we made together with AmSpa, Alex, and the folks at there, and we were told basically, "Hey, come on back some other time."
Oh.
which really is, I mean, look, that's the way law gets made. You pass what you can, and you have a placeholder for coming back when the next legislative session convenes.
Hmm.
So it's not over, and it's not a terrible law. In fact, it's not a bad law. It's a good start. Needs some refinement. How's That's what I would say.
Okay. Okay. And there's nobody else that has put anything like that into place besides Texas, is there?
Yes. You want to go dark? Some of the states that I mentioned as being regulatory heavy, uh, Rhode Island, Connecticut, Alabama, South Carolina, Louisiana, Nevada, um, their laws are make Jennifer's law look like manna from heaven.
Oh,
Yeah. Like
okay.
some of those states will say they'll say, I mean, despite our best efforts to communicate and import key opinion leaders into that dialogue, they'll say, "Hey, bag of saline, yeah, that's medicine. That's a drug." We're like, "What?" And they're like, "Yeah, and if you put anything in it that's compounding, you have to have a pharmacy license." I kid you not. I mean, the clinicians on this call will be shaking their head because it doesn't make any damn sense. Wait a minute. Bag of saline's a drug? Yep, drug. And some state regulators have been that specific. Add
Hmm.
anything to it, compounding, IV hydration, you know, in a small town, you need to go get a pharmacy license with a pharmacist on site.
Which is never going to happen.
Yep. Now, so most of that activity is not in the form of laws that were passed. Most of the activity is in the form of statements by the regulatory bodies in that state: Board of Nursing, Board of Medicine, Board of Pharmacy, and they'll issue joint statements. You can find them all over. AVA has them on their website too. Um, so, it's everything from rational to they're not even trying to be rational. And where does Texas fall? Really rational,
Yeah,
rational. Yeah,
I like
I'm
that.
sure.
If you're going to have regulation involved, which to some degree we need, then being rational is much better than the overstatement of it and the over practicing of it. So
Yeah,
it's
I mean, Florida had a proposed law, the Belay Act, Stephanie Belay Act, is a horrible, horrible background. Young nurse died after receiving an IV, and so the decision made by the sponsoring legislator was that, oh my God, IV hydration is dangerous, needs to be regulated. Here's the problem. In that situation, which I'm intimately familiar with for confidential reasons, um, that IV bag was administered in a physician's office, and the physician's staff put stuff in that shouldn't have been put in. So what is that? Is that a problem with the IV hydration industry? No, it's called medical malpractice. That's what that is.
isolated situation of poor judgment.
Yeah, yeah. So I remember getting in the early days of before we even formed AVA, a newspaper in California sent, because they heard we were forming this organization, they sent us pictures of a woman who was terribly bruised through IV hydration. And I noticed that the bruising pictures they sent was all around the woman's midsection. And I said, might this be mesotherapy? And the journalist said, what's that? I said, that's the shit that you inject that causes bruising to lose fat.
In the
The people
midsection.
in the midsection, by the way.
Yeah, IVs don't usually go there.
Like maybe that's a unique person. You can get a vein right in the midsection. I've never seen
Sure.
it, but hey, I'm not a clinician.
Super, super lean person who doesn't need mesotherapy for fat loss.
Right.
But you just summed up the whole, well, what I was going to say is one of the main points in having you here is that you know your stuff, you know this industry. If nothing else, you were introduced to these folks who are interested in stem cells and do all the other things as well. And so now you know each other. And if
Good.
you need some legal insight, some help, you know that Jeff knows who you are. You know that he knows what you do and how you would like to practice. He's very familiar with laws and states and so on and so forth. And he's going to keep you on the straight and narrow, even if you don't like it. Here's what you need to do. Follow protocol, even as annoying or time consuming as it is. And on the reverse side, Jeff, you've promised a couple of things over the conversation, and I'll get those from you and we'll put them out in the recording. One of those would be, how would somebody get in touch with you, or what's the best way if they would like to talk to you further or get some of your services?
Cool. I'll do that. Thank you, Kim.
You're welcome. Thanks for being here to you all. Hopefully this was insightful and educational for you. And we'll be doing it again sometime soon. If you're here or you're an eBoo provider or want to learn more about eBoo, we're going to be doing our eBoo Mastermind next week. I was out of town when we normally have it, so we're going to do it next week. You'll get a notice of that. And it is being recorded, so look for that in your email and share it with any of your other fellow providers that could benefit from it. So appreciate you all. Thank you so much, especially you, Jeff. It's always a pleasure.
You too. Thank you, Kim.
Take care.